So you had talked a little bit earlier about different symptoms for women sometimes. Can you talk more about symptoms in men versus women and also maybe different courses of treatment in men versus women?
Well, ironically enough, because in the past women had been approached much more lackadaisical, much more, we looked at their cholesterol and said, oh, it looks fine, they'll be okay. We realized that's not the case. And we look at the menopause, which is a dirty word. It doesn't occur at 50. It can occur at 40. It occurs whenever the hormones start decreasing in women. So that we actually have to approach that much more. When women lose their protection of their hormones, they also, if they have some family members that have heart disease, they start getting it even earlier. And ironically enough, if they do develop vascular disease, I shouldn't just say heart disease, it's more complex. They develop more hardening of the arteries. They develop more arteries involved. And as I said, their symptoms are much different, so that a lot of times they come to us much later in the course, and we have more to fix. And it becomes more complex and much more dangerous. So the idea is, again, to get to it before it gets to you. I say that a lot because it means a lot. It's very important. And again, because our symptoms, I say any change in how you behave, any change in how you usually are, is something that needs to be addressed. So if all of a sudden you have heartburn that's not going away, or you're belching, or you're dizzy, or you're tired more than usual, it may not be the flu, and it may not be a bellyache, it may be the heart. And we see this, and as I said, I've been doing this quite a while now. Every time I think that I've seen it all, somebody turns around and surprises me. Right. They did that at 7 o'clock this morning. So that it always happens on a regular basis to all heart doctors and all primary doctors for that matter. And we have to keep on the lookout, if you will, for any changes in our behavior or our pattern.
So people need to listen to their bodies when they're telling them
Absolutely.
things.
Absolutely. There's a lot of misconceptions, and it's our job to educate the community, and it's it's the person's job out there to try to stay on top of it instead of waiting for it to happen. And that's really the issue.
What made you go into this field?
I saw open heart surgery when I was 8 years old.
Wow.
Oh,
My father has been doing this for many, many years. And I did lots of house calls with him when that was the thing to do. And he delivered those kids that he still takes care of today at 67 years of age. 68, actually.
He's still practicing.
Still practicing. And, the interesting thing is that he's a heart patient. And he takes care of himself, and I take care of him as well. So that the bottom line is that I'm proud to be that person who saw, heart being worked on long ago and said, this is what I want to do for my life.
Wow. Where did you train?
I trained at Albert Einstein Medical Center, and I spent 7 years, did all my medicine and my cardiology there.
Oh, very good. Good credentials.
Now, what local hospitals are capable and prepared to handle maybe the more advanced cases?
Well, really, the only hospital that's prepared to handle the advanced cases is Jersey Shore Medical Center. They are open 24/7. Have an excellent cardiology team. An emergency team that's working day and night. They are just put in a full expansion and continue to expand their cardiology area. They have wonderful bypass surgeons if necessary, but they have a full scale approach in terms of maintenance and prevention. It's always been, I think, Jersey Shore Medical Center's approach to try to educate the public as well as prevent this from happening. But in the event that there's a problem, they have a all of the cardiologists and all of the staff, they have a wonderful crack team, if you will.
When did Jersey Shore get their accreditation?
Oh, they've been university for for a number of years now, affiliated with Robert Wood University, and have both medicine, even cardiology fellows training there. So it's a full teaching hospital. They have a level 1 trauma center as well. So whenever somebody's in an accident, they're usually airlifted there. It's if you've driven past lately, you'll see a huge expansion project. So That's your closest hospital in an event of emergency that you're going to be taken to from that standpoint. There's a lot of hospitals around in the area, and I don't want to slight them because I belong to most of them, and I'm proud to belong to all four of the Ocean County and Monmouth County hospitals. But in the emergency situation, the Jersey Shore Hospital is
because years ago people used to go to New York, and now you have accreditation in heart.
That is correct.
And so we're very lucky to have you so close by.
Yes, we're very lucky to have the hospitals close by.
Absolutely. So what would be the most important, maybe one or two life changes that people could incorporate into their daily lives that wouldn't be huge, but things they can do to make an impact on their heart health?
Number one, walk, and more walking. You don't have to run. You don't have to do anything. If you can't walk, get into a pool and walk in the pool. If you can't do that, find one of those bicycles where you can lean back and take the pressure off of your joints and even pedal. Anything that you can do 30 minutes, and if you can't do 30 minutes, do 10 minutes 3 times a day. Any accumulation of about 30 minutes a day, or at least 3 days a week, is better. And believe it or not, you'll significantly put a dent in your mortality and morbidity, which is life and death, and illness and health. Number 2, if it looks good, don't eat it. Number 3, if it moves or oinks, don't eat it. I make fun, but the bottom line is that, as I said, this Mediterranean lifestyle, you'd be surprised that most of the things that have saturated fat and the carbohydrates that we eat.
I have to cut out my ice cream.
You have to cut out your ice cream.
Okay.
I'm sorry.
All right, I'll do that.
But frozen yogurt with no sugar added is just as tasty. So that we can make the changes and substitute those changes. And these days, even pasta, they have pasta doesn't turn into sugar and cholesterol that you can eat.
They have whole wheat. Is that what you're eating?
Even better than whole wheat is something called Dream Fields. Okay. And we have that, and I feed my young children this as well. They'll never know the difference. Okay. I could feed you a bowl of that and you wouldn't know the difference. Little changes go a long way.
You have to talk to our food vendors.
Absolutely.
There you go, yeah.
Absolutely. But you'd be surprised. You'd be surprised. Those things that say may help reduce cholesterol or may help reduce heart disease usually don't. Right. They're allowed to say that. So you have to understand that the commercial aspects as well as the real aspects. And you need to find yourself good natural supplementation, because not everything is created equal. Okay, but that being said, there are ways to change your diet that make sense. And again, you have to individualize for each person. I can't just say I can make global recommendations, but again, everybody has to look at their risk, whether you have diabetes or borderline diabetes, your weight, your family history, whether you've smoked. There's so many different things, high blood pressure, all different cholesterol makeup, as I had said. So, again, each person has to take their own individual risk and qualities and do something about it.
Right. And they can do that through the help of your services.
That's right. You need to just seek out someone that has some knowledge in this area. And it's not just here, take a pill, see me in a couple of months. Right. It's not that simple. Even things such as blood pressure. Go out and get a little machine, check your blood pressure yourself. It's often high when you're waiting in a doctor's office for a while, or you rushed and you got lost. There's a lot of reasons. We like our patients to have homework. We give them homework assignments. It's very important to take matters into your own.
Do we have a phone number where we can get in touch with
Our
you?
main number for our office, my partners, Drs. Robert Kaiser and Dr. William D. Lorenzo, and myself, we're known as Change of Heart Cardiology, because it's an appropriate name, because we want people to change their opinions about the way they look at their hearts. The bottom line is our main number is 732-974-6700. And we can mail out regardless of an appointment. We would be happy to mail out that packet of the 5 misconceptions, the 5 things that you think you know about heart disease, but we're so wrong, along with the list of the foods that are recommended to anyone who is interested.
Great, and there's that number up on the screen. Perfect.
Our team is so good. I just put it up for you.
Terrific.
Well, thank you so much for being here today. We learned a lot.